So why should every mom postpartum go and see a pelvic floor physical therapist, whether or not they're having any pelvic floor symptoms? I'm going to tell you why I believe it is so important for every mom to even just go for a few, like the first assessment or even a few follow-ups, just to kind of start their healing journey, even if they're feeling pretty good, right? First of all, birth is an experience that changes your body physically quite a bit, whether you had a C-section or a vaginal delivery, okay? A C-section is a big surgery, not to be taken lightly, and the tissues that they go through in your abdominal wall, even though they stitch them up and the incision has healed, maybe it's healed by your 6-week checkup with your GYN or midwife, even though that tissue has healed, the abdominal wall has not returned to its normal function, and often it needs training to get there. Just like any other injury, like an athletic injury. If somebody tore their meniscus or sprained their ankle or had an ACL tear or rotator cuff tear and had a surgery for it, they don't just go back to the sport. They don't just go back to even their activities of daily living without rehabbing that part of their body. So why is birthing any different? I don't know. It shouldn't be. It really shouldn't be. And so that's a C-section, but then with a vaginal delivery, if you tore, right, you've also then disrupted the integrity of the pelvic floor, right? Just carrying a baby through pregnancy is quite a big demand on your pelvic floor as well. So I actually want to just show you in this model right here of the pelvis what happens when you birth vaginally. And I put these little rubber bands on here so that you can see just the outer part of what would be some pelvic floor muscles, how they kind of go up to the pubic bone here. They come down here to the tailbone and sacrum, and then they go across to the sit bones. And then this would be like the perineum, the space between the vagina and the anus. Now during childbirth, if you can see this, the sacrum and tailbone has to move back to get out of the way for the baby to come out. The sit bones need to spread, so everything opens. And often there is a rotation that also occurs within the pelvis and the sacrum so that the baby can come out. You know, depending on the position of the baby, that rotation might be different for different birthers. There is a very common birth pattern that occurs, since most commonly the back of the baby's head is on the left side, and the way that it rotates during the birthing experience. So when that opens up, like the sacrum and tailbone moves, like how I can like see you through here, right? And the sit bones spread or the pelvis rotates and it's kind of off like this, it doesn't just always magically kind of go back to how it was prior to birth and prior to pregnancy. So things are a little bit thrown off within the pelvis and the sacrum. And that could be creating a sense of weakness in this area, a sense of discomfort if there's more pulling on one side than the other. So even just to get all the pelvic bony structures rebalanced by a pelvic floor physical therapist that specializes in postpartum care could be so beneficial to every single mom, right? And again, even if you had a C-section and you didn't birth vaginally, and so you didn't have as much opening, some people who have a C-section actually do go through a pushing phase first, and so there is a lot of pressure down below. But please remember that your C-section incision is right above the pubic bone, and behind that is the bladder and the uterus, and then your abdominal wall connects down there too. So it's also very important to get your abdominal wall assessed, see how your bladder and your uterus are moving, see how the scar tissue is moving there. And even if you didn't birth vaginally, but maybe you pushed, and maybe you didn't, but you carried a baby, so there was still pressure down below on your pelvic floor through your pregnancy. So it's good to get that checked to see how the function is and just start to regain some awareness and coordination of those muscles, that part of your body. So I just wanted to show you this whole like pelvic alignment and sacral, like how everything kind of moves and opens with birth. Because sometimes moms don't have issues right away. Their attention and focus is not on them, it's on the baby. And so some stuff might just be overlooked, or like the sensations they're feeling is like, oh, that's just like normal postpartum stuff. Or they're feeling pretty fine. And it's not until later down the road, a week later, 2 weeks later, 5 weeks later, 5 months later, a year later, however much later, 5 years later, where they start to notice dysfunctions like leaking urine or prolapse, and the signs of prolapse. Maybe it's like a heaviness, or they're feeling that there's something like falling out, or pain with sex, or pelvic pain or back pain, or any of those types of things might not pop up right away. It might not pop up until you start doing more things in your day, or it just might not pop up until these changes that have happened in the pelvis, because our body is so like resilient and adaptable, until we kind of start to compensate for it and then are doing certain tasks and noticing like, wow, this is, you know, when I sneeze, I leak urine, or when I go for a run, I'm feeling this heaviness in my pelvis and in my vagina, or I was going to the bathroom and I saw and felt something and I'm like, what is that, right? So sometimes it's not right away, but oftentimes it started from birthing, not to scare you from birthing, but so that you understand the importance of caring for your body after you birth. It's a beautiful event. It's a beautiful moment, but I think that moms really need to be cared for more. And it's one of those things that I am always like, why is it not even just suggested to every postpartum mom, so that the mom can make the decision of, okay, I'm going to go do this for me. I'm going to go get my pelvic floor checked. Or it's not just the pelvic floor, it's like the whole body, right? So like what goes on actually? Let's talk about that. What goes on during a postpartum pelvic floor evaluation? At least what goes on when I see my patients. I spend a lot of time just asking questions and talking in the very beginning, because I want to find out what their birth story is like, what they went through, how they perceived their birth to be, so I can get a sense of where they're at, and if they felt like anything was traumatic, or if they felt like everything went smoothly. Is there any issues going on in the bladder? And I ask a million questions about the bladder. Even if they're coming in and they're just saying everything's fine, because sometimes they think it's fine, but when you ask the right questions, they don't realize that that's even an issue until the question is asked, right? So it's not just tell me how your bladder function is. You know, that's so general. You're not going to get an answer. It's questions like, how frequently are you peeing every day? Is it more than 8 times a day? Are you going less than 5 times a day? How long in between each pee can you hold it? Can you hold it for more than 2 hours? Or do you feel like you're peeing every hour? Are you leaking any urine when you cough, when you sneeze, when you laugh? What about when you get an urge to pee? Do you start to leak a little on your way? Or do you feel like you might leak? Or do you feel like, oh my gosh, I got to run to the bathroom right away? These are like more specific questions, right? Your GYN is not going to ask you this at your 6-week checkup, okay? But your pelvic floor physical therapist will. And then tons of questions about your bowel health, right? How many times a day are you going? What's the consistency like? Are you straining at all? How was it before you had a baby? How was it during pregnancy? How is it now? Like trying to see all the, kind of comparing where you were to where you are now, and things like that. How is your sexual health? And now if this is after 6 weeks of birthing, Often there is not sex yet, and that's totally fine, you know, but sometimes people don't come until a year later for their postpartum or months later. And so that is definitely something to kind of dive into and see how it feels. Is it pleasurable for you? Is there any discomfort or pain? Do you have any desire? How are you feeling in your body? Just like a little bit more specific than just like, how's your sexual life? How's sex? You know, how's your sexual health? Questions about your exercise. What do you enjoy to do for exercise? What do you want to be able to do? Is there anything you're worried about doing? What types of fears do you have about returning to exercise, so that I know where you want to go, what your goals are, and like what might be holding you back. If it's like a fear, or if you just don't know where to start, or you're just too tired, you know, anything like that. You know, so that's just some of the questions. We go into menstrual health, we go into your eating habits, any past medical history, all that stuff. So we talk for a long time. And then we don't just dive right into looking at the vagina. You know, it's not all about this. It's not all about the vagina. It's actually starting by looking at your whole body. How is your posture, right? Are you still standing as if you were pregnant? Do we need to shift anything when you're standing? Where is your weight through your body, through your feet, right? How are the forces going down your spine and into your feet and grounding? Or is it kind of stopping part way and putting some forces and pressure at your low back, at your spine? You know, what do we need to shift there so that you can feel more comfortable when you're upright? And just checking out things like spinal mobility, hip mobility, flexibility of the legs, feeling the abdominal wall and how it moves, how your rib cage moves. You know, during pregnancy, all the organs kind of shift everything up into the rib cage. So oftentimes the rib cage expands and is almost like stuck in an inhalation position. So feeling the rib cage and seeing if it's able to move out and in. Is it equal on the right and the left side? Do things need to kind of be rebalanced there? Getting into the pelvis and checking on the alignment of the bones and what needs to shift there so that things are more balanced out. If you had a C-section, looking at the C-section scar, checking out the uterus, the mobility of the uterus, the mobility of the bladder. Yes, the organs, you can see how they move. And then, you know, eventually getting down to the pelvic floor and taking a look at the function of the pelvic floor, right? The muscles between your sit bones and pubic bone and vagina. So taking a look here and seeing, here's the two sit bones, tailbone, pubic bone, urethra, vaginal opening, and anus, right? So looking at these muscles and seeing how they function. Is there any tenderness here? If you had an episiotomy or a tear, what's that scar tissue like? Is it moving? Is it painful? Can you do a Kegel and tighten your muscles? Can you relax them? If you had to poop or birth, you know, can you lengthen them? Is it the same on the right and left? All right, so looking at the outside, feeling for any tenderness around here. And then internally, you know, at some point looking to see how the internal pelvic floor muscles feel and function and move. Okay. So I know that was a whole lot, but I just wanted you to see that a postpartum pelvic floor assessment is very different than when you go to your GYN or midwife postpartum at 6 weeks and they ask you, how are you doing? Maybe they'll check your belly super quick. Maybe they'll do an internal and say, like, squeeze my finger, but maybe not. Maybe they'll just say, okay, everything's fine. Everything's healed. You're good to go, right? It is not that way at a pelvic floor physical therapy evaluation, okay? And then it's also educating you on your body. This is kind of where you're at right now. Let's wait a little bit before you do this. Let's start with this type of exercises and movements for your body so that you can prepare yourself for these things you want to do. If you're leaking urine, or if you have prolapse, or if you are having pain with sex, let's start with this type of thing for you to help you progress, you know, giving you a more specific guideline or more specific advice if there's an issue. And if there's not an issue, it's just going through those what I say, like typical postpartum things that need to be checked. Everything I talked about before, right? The rib cage, the abdominal wall, the pelvis, the pelvic floor, working on just reconnecting to your pelvic floor. Can you feel these muscles? Can you feel them moving? Can you use them with your breath? And just kind of starting you on that journey towards feeling stronger and like you're taking more ownership of your body. So I know I just talked forever, but I am really passionate about helping moms. I really believe that this is an area that, at least as in our country, or in my country, in the United States, we're really slacking on our care for postpartum moms. And so I really hope that this kind of spreads. If you know somebody who's had a baby or is pregnant, or if you're pregnant yourself, that you take this information to heart and like look for somebody who is local to you and reach out to a pelvic floor physical therapist. Often you can call the office and have a little phone chat with them and see if they're the right fit for you. Because it's just one of those things that you're gifting yourself something that will help you not just now, but down the road. Okay. So any questions or comments, go ahead and let me know below. I'd love to hear from you. You can also check me out on Instagram at Ashley Hocutt. Yeah, so love to you all. Bye-bye.